Hey everybody, my name is Darian Dozier and welcome to Melanated and Meducated. So as you worked through medical school, how did you decide on primary care and, why is it important to you to be a primary care physician?
So I like to say that family medicine chose me because I initially started my medical journey really thinking 100% I would be an OBGYN. And that was because prior to medical school, my experience in volunteer work was mostly with women's health in the realm of OBGYN. I was a labor and delivery volunteer, and then I shadowed my OBGYN who had her own private practice. And so my experience was mostly from an outpatient OBGYN experience. And I thought that's what I want to do. But then once I had my third year of medical school, my first rotation was OBGYN. And I was in the OR most of the time. And I was like, wait, no, I love the clinic. I don't like surgery. I don't like surgery at all. I don't like the OR at all. It just wasn't me. And I didn't realize how much surgery was truly, a majority of their specialty. And I think it's a
Right.
wonderful specialty, but it just wasn't for me. And so then I through the rest of my third year with an open mind, like, okay, well, I don't know what I want to do. And I didn't like anything. I was so concerned third year because I would go on these different rotations and I would find it interesting, but I didn't want to do it the rest of my life. Or I would say that was really cool to see one time, and that's enough for me.
Right.
And so then once near the end of third year, I had family medicine. And growing up, I didn't have a family medicine doctor, so I wasn't familiar with the specialty. Basically, we used my OBGYN, I used her as my primary doctor. And then if I had like an acute illness, I would go to urgent care. So that was my experience in Las Vegas growing up. So I had no idea what family medicine is or how it was different than just going to an urgent care. And once I rotated there, I was like, okay, this is what I love. I loved knowing a little bit about everything. I loved the in-office procedures. I loved the women's health aspect from the clinical standpoint and talking about contraception and all the things that family medicine doctors do. And I loved the age range. I just wasn't bored. It really kept me on my toes. And I felt like every day was a new experience.
Right.
And I really loved it, and I still love it. And so it ended up being exactly what I dreamed of doing, but I just hadn't experienced it because I hadn't had a family medicine doctor.
Right. So, what advice would you have to medical students, either those who absolutely are like, I'm going into this, or those who are like, I don't know?
I think both of those are okay. If you don't know, that's great because you can go into third year, especially when you start your clinical rotation years, with an open mind and being like, I'm going to dive into each rotation and really look at what the lifestyle is like and ask questions and really see what I gravitate to and love. The main thing is being like, what could I do for the rest of my life and love it? Because you don't want to be unhappy, especially
Right.
all we go through to get there. You don't want to be unhappy. And
Right.
if you're really sure about what you want to do, also realizing that every single rotation has something that you can grasp to help enhance whatever specialty you plan to go into, even if you have no intentions of ever doing it again, you will then know what that is like. Because even if you're an OBGYN, your patient may have urological specific issues and you will have to refer to a urologist. So on your urology rotation, really taking in, okay, well, what do they do? Well, what happens when I put a referral in? Every single rotation has a pearl that you're like, okay, at least I know what they do. I know what I'm sending my patients to, and I know the appropriate person to send my patients to. I know how the system works on this rotation or in this specialty. So it's still golden, regardless if you know that it's not for you, but it's a part of the healthcare system. Your
Right.
patients are not just one organ system.
Right. So essentially, when you're going through there, find the little things that you can out of each specialty that you can take with you, whether you know for sure you want to go into something or not. Because at the end of the day, everything will come full circle.
Absolutely. Absolutely. And the more tools you can have in your tool belt, the better position you will be.
Yeah, that's kind of where I'm at now because I'm very certain about what I want to do. But I think the things that I'm learning in medical school aren't particularly interesting to me right now. So I'm at the point where I'm like, I need to find some way to connect everything I'm learning to what I want to do, not only so it's more interesting to me, but just, so I'm not wasting these 2 years just trying to fly by them when I can take so much valuable information out of everything we're learning.
Absolutely. And especially those first 2 years where you're not on rotations, you're in the classroom and you're in the books. I definitely am a hands-on type of learner and a hands-on type of person, and I get bored with just reading and watching videos and listening to lectures. So I had to find ways to make that learning process fun. And so that's, another thing to really brainstorm is like, okay, well, I don't like this, but how can I make this interesting to actually sit here and take in and regurgitate?
Exactly, exactly. So that's where I'm at right now. I definitely was not there last year, but I think I'm getting the information a little bit better this year. So I think this new approach might be working. We'll see.
Right. It's trial and error. It's trial and error.
So can you describe your road to residency and maybe any advice you have for current medical students?
Yes. So for residency, so like I said, for medical school, I was in the Midwest and I wanted very much to get back to the West Coast, close to home. I love Las Vegas. So I knew I wanted to eventually be there. There's one at the time that when I went through, there's now two, but at the time there was one residency program in Nevada, close to Las Vegas. And then there's, of course, plenty in Southern California. And I always wanted to be in California, even if it was for a short period of time. So residency was ideal. And so I applied to a lot of California schools, to the Las Vegas school, and mostly West Coast. And of course, I did some Midwest since I was in the Midwest. And, I think really researching programs based on your values and based on what you're really looking for from a program, knowing what you want from a program. For me, I knew that I wanted a program where I felt diversity amongst all levels within the residents, within the patient population, and within the faculty. And so that's what I looked for. And then I also knew in residency, I wanted to have a family and start a family. I was a newly married woman and we knew we wanted to have children in residency. So a family friendly residency program was important to me. So I was also looking out for, are there women on the faculty? Are there residents that have children or that are pregnant or that have newborns? So all of that was very important to me. And then ranking those programs appropriately among, based on what you really value.
Right. Okay, that's excellent advice because I think sometimes you get caught up in I'm just going where I can get in. But if where you get in isn't a good fit, then what's your experience really going to be like? So being really mindful about where you're applying and why.
Absolutely. And being strategic. So you're like, okay, let me apply to some that I'm most likely to rank favorably in their eyes, but let me put my desires first. When you're creating that rank list, it's about what you really truly want, where you want to be in that order, and then also putting, somewhere on the list, the ones that may be more safety, but you may, get into for sure, but may not have all the components that you really are excited about.
Exactly.